Okay, I wonder if you were aware that at the end of November this year saw the first ever Pulmonary Hypertension Awareness Week. There's a mouthful and a half. So I got wondering about this, and I wanted to know more about the condition and why they were trying to raise awareness of this condition. I did speak to the Pulmonary Hypertension Awareness Association in the UK. I have to say that very slowly. And they pointed out that it's a serious condition. It causes high blood pressure in blood vessels connecting the heart and lungs. It's very rare and people can be born with it or develop it. And they want to raise the awareness because it can be such a serious condition to live with. They wanted to encourage conversations about PH, which is how we're going to refer to it now. And when I say we, well, I'm joined by the consultant of adult congenital cardiology at Glenfield Hospital, Simon MacDonald. That's lots of mouthfuls today. Hello, Simon.
Hi there. Delighted to join you this afternoon.
Oh, well, thank you so much for coming. Tell me, just first off, what is PH?
So pulmonary arterial hypertension is a condition in which the blood supply to the lungs, the pressure is higher than normal. And this is important because the right side of your heart pumps blood to your lungs to get oxygenated, and then all that freshly oxygenated blood goes to your left side of your heart and then to your body. So because of this, the pressure in the lungs is high, the right side of the heart has to push a lot harder, it becomes thickened, what's called hypertrophy, and then it begins to fail. And that has a number of knock-on consequences.
So what's the difference between that and hypertension, which is blood pressure, is that right?
Yeah, so hypertension is just high blood pressure. But what's unusual here is that the pulmonary artery is generally a low-pressure system. Your lungs are a bit like a sponge in that the blood should be easily pumped into them. They get freshly oxygenated, then returned to the left side of the heart. So the pressure generally is what's about a third or quarter systemic pressure. So your arterial blood supply is under a lot higher pressure. Your left ventricle is thickened and can handle that quite readily. But when the pressure in the lung goes up for a number of reasons, then it can present with a number of key symptoms.
Okay, let's talk about those symptoms because something you just mentioned whilst we were listening to Lindisfarne there was that there are many people who are living with this condition that haven't been diagnosed. Right. So what are the symptoms first off?
So the symptoms can be a bit non-specific. I mean, a common symptom is breathlessness. So you may notice that going upstairs or you're going out a walk with family and friends and walking up an incline, you fall behind. You just can't keep up with people, and it can be gradual in onset. Another thing that can present, you feel tired all the time, and these are a bit non-specific symptoms. Again, with the right heart, it's pumping hard, it becomes a bit hypertrophied. You can get unusual heart rhythms, what's called palpitations. You can be aware of your heartbeat slightly erratically or when it seems inappropriately fast. And related to that, you can get episodes in which you can black out. All of a sudden, for no apparent reason, you seem to sort of pass out. Other things that can present with are abdominal pain or and right heart failure, which causes your tummy to swell or your legs to begin to swell. But the commonest symptom is just breathlessness.
I mean, a lot of us, I suffer from breathlessness at different times of the year, particularly in winter, because I'm less active. So if I'm thinking, well, do you know what? I have been rather breathless the last few weeks. What should I do just to clear my mind and put my mind at ease?
Well, I mean, some of us, you can get breathless due to a number of reasons. It's quite a non-specific thing. So I think if it's something that's beginning to intrude on day-to-day life, and you notice that it's repeatedly, you just can't do things, it hasn't waxed and waned, it would be worth a review. Perhaps speaking to your general practitioner, just reviewing things. I mean, a couple of key features on taking the history, some key symptoms. Is the breathlessness associated with anything else? And then under examination, if there's a particular things, signs that you've got heart failure, you've got swelling around the ankles, you've got crackles in your lungs, or your tummy's a bit more swollen. And that, of course, the whole condition is what's called multifactorial, a number of things that can cause it. And then on taking a careful history, do you have these key things that can cause pulmonary hypertension?
So it sounds as if it's a questionnaire. You look at the different factors or different symptoms that are manifesting in your body. Then you get the diagnosis.
Yes, it can be due to a whole number of things.
Is it genetic?
Yeah, it can be a component. It's split into about 5 groups. The most common, unfortunately, is what's called idiopathic, in which there isn't a clear cause. And within this group, or group 1, there is a familial predisposition. People inherit particular genes that can cause pulmonary hypertension. And related to that, again, it can be a component in what's in congenital heart disease. We have people who are born with various holes in their heart or unusual blood supply, so they get a larger blood volume to the lungs, and the lungs react to that by becoming stiffer, and the blood vessels get hypertrophied, leading to the right-sided heart failure.
Just on the subject of the genes, the genetic side of it, because so much information now, we're beginning to learn more, isn't it, about genes. Are you able to be tested to see if you have that gene?
Yes, I think if there's a strong family history, you've got first-degree relatives, your mum, dad, brother and sister have got pulmonary hypertension, and they have a defined gene abnormality. Yes, it's something that we would readily do.
Can lifestyle affect it or bring it on or develop the condition?
Yes, I mean, another common cause of pulmonary hypertension is left-sided heart disease. So people who get traditional ischemic heart disease, who've had heart attacks, people who've got leaky heart valves, the aortic valve, the mitral valve, and they get higher pressure in the left side of the heart, which then feeds back to higher pressure in the lungs. So things that can improve your left heart are very helpful, such as healthy living, not smoking, if you're diabetic, controlling your blood sugars, and so on.
God, it sounds like it'll add to pre-existing conditions if you have a number of conditions, which is worrying, isn't it?
Yes.
It becomes more difficult to treat it. Well, on the subject of treating, we're going to pause for a quick song, and then we'll come back and we'll discuss how you would get treated if you are diagnosed with PH. Don't go anywhere, folks. Well, if you were joining us earlier, or if you've just joined us now, I've been joined by Simon MacDonald in Studio 2 here at BBC Radio Leicester, and we're talking about pH. I'm not talking about a chemistry experiment or anything. I'm talking about pulmonary hypertension, very different to hypertension, which is high blood pressure. And we've been discussing the symptoms, and I've just learned that the people who suffer from this, the numbers are relatively low, which makes it a rare disease, Simon.
Yes, that's true. I mean, in the UK, it's reckoned that there's between 6,000 to 7,000 people that are recognised, but it's probably, unfortunately, underdiagnosed, in that, as we discussed earlier, the causes of pulmonary hypertension are relatively diverse, and so putting it all together and making a clear diagnosis can be a little bit difficult.
If it's not treated, we'll talk about the treatments shortly. If it's not treated, what would happen?
Well, the main thing is progressive breathlessness. So people become more and more incapacitated with breathlessness. So instead of being able to get up the stairs, they can't manage to get upstairs. And in terms of at home, they're not able to walk from room to room. So really incapacitating breathlessness. Moving on from that, you can get unusual heart rhythms. There is a risk of an irregular rhythm, atrial fibrillation, but more seriously, what's called ventricular tachycardia, sudden heart rhythms that can result in collapse and possible death. And these could be preventable by early treatment and directing treatment at the underlying causes.
Okay, so treatment. You see, every time you say something, I think of another question. Underlying causes. I'm thinking, what? But let's talk about treatment. I understand that there are 9 specialist hospitals in the country, in the UK and Ireland, I think it is, for PH. We don't have one in Leicester. So if you are diagnosed with the condition, what happens to your treatment?
So first of all, again, is making the diagnosis. And as mentioned before, there's a number of different things that can lead to pulmonary hypertension. So left-sided heart disease, lung disease itself can cause it. People who smoke heavily have got chronic obstructive airways disease. People who get clots in their lung, people who have had valve replacements and so on. So I think the key thing is trying to identify reversible factors. So let's say with heart failure, improving left-sided heart function, so using diuretics to get rid of excess fluid, rate control if they have an unusual heart rhythm. So these are sort of general therapies. Moving on, we have a new group of therapies called targeted therapies. So in Leicester, we can do the initial assessment, we can do cardiac catheters to make the initial diagnosis, test for the high pressure in the lungs, test for how reactive the lungs are. And in Leicester, we can initiate some of these treatments. But you're right in that some of the other treatments are quite expensive, and they're rationalised in the UK between these different specialist centres. And for us, we liaise very closely with our colleagues in Sheffield at the Royal Hallamshire Hospital. The sort of therapies that are available are endothelium, relaxating type drugs. So there are a number of groups.
Like a sedative, is it, or something like that?
No. Well, there are a number of groups. We want to dilate the pulmonary arteries. A common group of drugs is calcium channel blockers. They're commonly used and quite cheap. The next group is phosphodiesterase inhibitors. So these are drugs like sildenafil, which we often hear used for men's impotence. But in the lungs, it also dilates pulmonary arteries, and there's quite a good functional improvement in some people. So that's sildenafil. Moving on from that, we have endothelial antagonists, receptor antagonists, and these are expensive drugs called bosantan, macitentan, ambrisentan, and there we do that with a joint workup with our colleagues in Sheffield, and we're able to make the diagnosis and then get the drugs delivered to people in their own home without a trip up to Sheffield, but it all gets delivered to their home, taking it out of GP's budgets, and so the patient doesn't have to go out to get the drug gets
That's
delivered to them at home.
Isn't it?
Yes.
Yeah. Just to round off, do we know how many people within Leicestershire and Rutland have been diagnosed with this? Just I'm thinking locally and regionally.
Yeah, so in my own particular field, congenital heart disease, we have about 60 or 70 patients with pulmonary hypertension, about 40 that are on targeted therapies, but my respiratory colleagues will have some. And I think if we take all comers, people with clots in the lung, people with a respiratory disease, it's estimated there might be about 350, 400
Really?
people in Leicestershire. And again, part of the problem that we have is making the diagnosis and getting to these people.
Okay, Simon MacDonald's fascinating. And like you said, it's the crossover between different conditions and the really vague symptoms, which could be anything, and yet underlying could be quite a serious condition.
Correct.
Yes. Simon MacDonald of Glenfield Hospital, consultant of adult congenital cardiology. Thank you so much for joining us here on BBC Radio Leicester.